I'm Dr. Leibovitz, the founder and owner of Fort Harrison Podiatry. I've been treating foot and ankle problems for over 30 years, and you'll find my office a couple blocks just outside the entrance of Fort Harrison State Park. So why don't you come in, we'll talk about the type of people that get foot and ankle problems. Well, I find there's two different types of people that have made up the world. There's people that have foot problems, and there's people that are going to get foot problems. Very few of us have the perfect foot. We're still several thousand years of change and evolution away from having a weight-bearing structure that's not going to give us any problems. Now, there's a few things in my office that you won't find, and one is a crowded waiting area. We don't run a medical assembly line. We're not racing to treat patients every 6 minutes. My staff does an incredible job arranging enough time to address your particular problems. So if you're a new patient, you're going to actually have to talk to my staff. They're going to ask you a series of important questions to determine how much time you have, so you can actually help us help you. Now, when you come in, you'll review the information you gave us, sign a couple forms, and then you can be brought back into the treatment area where we can start helping you. So let's take a look around and see some of the state-of-the-art treatments that we have here. And this is the laser we use in our office. It's integral part of our combination therapy for onychomycosis. It's also used and incredibly effective for wound healing, and it's a regenerative alternative to steroid injections. Plus, the big bonus is you get to wear these styling glasses. Well, this is the ultrasound we use in the office. It's used to determine soft tissue problems. It does not use any radiation, unlike x-rays, which are really good for bone. This is good for soft tissue. It's quick, it's inexpensive. It many times can avoid an MRI, the expense of an MRI. It's also the same technology that's used to determine gender with fetuses, but they use a different head, so we can't have any gender reveal parties at our office. And this is our office ABI testing. It measures arterial flow. It listens to blood flow while we inflate and deflate blood pressure cuffs. There's no tubes, no wires. It's Bluetooth connected, so it's pretty quick. And if you don't mind the hum of a blood pressure cuff for a few moments, that's the only bad part about it. This is designed for at-risk people, diabetics, smokers, people that have heart disease, so we can get a really fast and rapid idea of their blood flow. Well, thanks for looking at my office. We think we do a pretty good job taking care of our patients. Hey, but don't take my word for it. Look at over the 100 reviews our patients have left for us from multiple platforms. As President Lincoln said, you can fool some of the people some of the time, but you can't fool all the people all the time. If you're interested in finding out more about the most common foot and ankle problems, you've come to the right place. My website at gotofootdoc.com has plenty of content, videos, and FAQs. That's foot and ankle questions. My staff and I look forward to meeting you. I'm Dr. Leibovitz, your Central Indiana go-to foot doc.